So operationally, the Odessa has impacted our workforce in two really big ways that I can think of off the top of my head. So the first is that with other platforms, given that we had a lot of technology issues, it would often be necessary for us to send one of our staff members out to a home to actually make a visit happen. So that's tying up resources, healthcare resources that could be used elsewhere just to make that visit take place. It's just not practical to do that or possible to do that. So it has allowed us to make more visits happen and happen dependably. The second thing is the impact that it's had on caregivers, because in the past with other platforms, it's been 100% necessary in many cases for a caregiver to be present with the patient during the time of the visit, both to be aware of what's going on and be included in the visit, but also just to facilitate getting the visit up and running. And with the Odessa platform, neither is necessary. So the patient is able to connect without the help of a caregiver, which allows us a lot more flexibility in our scheduling because we don't have to work around the caregiver's schedule to get them physically there. But also it's freeing for the caregiver because they can hop on the call in addition to the patient from a third location, and they can participate during a break, during their lunch hour from another city. So that has provided peace of mind to the caregivers, who we also consider to be part of our care team. So it's been a relief for them.
So Odessa has impacted our workforce positively by enabling our providers to see more patients more efficiently. So if we have an acute visit that comes up and our provider's out in the field already, Odessa's made it so easy that our provider can get her laptop out and call in to that patient and do a visit from essentially anywhere. It's given us flexibility. It's given us the ability to see more patients so we can increase our patient load. It's also given the providers a much better visit, as far as quality visit, when they are performing those telemed visits. Our providers have been very receptive and open to the Odessa system because of the ease that you can use it. Our providers will have started identifying patients that need Odessa. So they even will now come back to the office and say, oh, this patient needs Odessa, because they've identified the value in the system and the ease with which you can use it. These providers, in the past with other platforms, you would try to initiate a visit. You would spend literally 20 or 30 minutes trying to connect with this patient. They couldn't get the microphone on. They couldn't do any number of things. But with this system, it's, you know it's going to be there, it's going to work. And if, the patient, it's very easy for them to answer it. So all of those stumbling blocks and roadblocks that caused frustration with our providers in the past, those things have been worked through with this system. And so, the providers want the patients to use Odessa because it makes for a much easier and fluid visit as well.